Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, April 30th. Welcome to you, and welcome to Ed Brubaker, our Living Branches President and CEO. Nice to see you.
Good to see you, Alex.
I see we both did laundry and found our appropriate vaccine shirts.
Found our vaccine shirts today. Now you won't know which video week it is when you post it, though.
Correct.
But yes,
We'll have to muddle through somehow.
yeah.
Let's start with our COVID counts. We do have staff persons who are testing positive on various campuses. This number is ticking up a bit. So at Doc Woods right now, we have 2 staff persons who are testing positive. At Souderton, there are 4. And at the Willows, there is 1. These numbers have been going up and down the past couple of weeks. So it's changing rapidly. But that's a bit higher than we've seen.
Maybe a little bit higher, but it's been like 4 to 7 or whatever in that range. What has been, I would say, steadily increasing, although not exponentially, is the number of people that are out due to exposure. Because these people are obviously out if they have it, but then there's other people that are out due to exposure. And so that, I think we may have had about 20 as of our meeting yesterday with CRT. So that was going up a bit because I think it had been maybe 10 or a little bit below that a few weeks ago. But the reality is there's still COVID out there in the community. And what we're seeing too is it's younger people, and you hear that on the news. One of the challenges with that too is that I guess Moderna is one age, but Pfizer, I believe, is 16. I think Moderna might be 18, but they're trying to work at it to find ways that they can get it approved for, below age 16. But the reality is if those are the persons that live in your household and you can't get them vaccinated and they pick it up at school or daycare, then that's an exposure for us, and it potentially puts their vaccinated parent in the exposed category. And we have seen breakthrough cases, meaning cases that came in vaccinated persons, and that tends to be from household close contact. So you can see all these things kind of intersect with each other, and it just shows the challenge of not being able to get younger persons vaccinated just yet has an impact on all of us too. So it's just kind of a strange place we're in. We're still, I would say, much better than last year, and certainly there's hope for the future, but there's these strange anomalies that are going on. Having said that, when you look at what's going on in India, we have nothing on them. And so we never want to get to that point ever again. But because we already have, still 300,000 reported deaths beyond what they have. But it just shows the importance of being vigilant, but also getting the vaccine.
Yeah. Well, and I think it is worth pointing out for our situation that the people that we see now that are actually developing COVID or testing positive, it's coming because of household contact.
Correct.
They're not getting it on our campuses, which is wonderful.
Right, that's right. And certainly we harp on it. I harp on get the vaccine, and I will continue to do that. And I know some people object to that, but I will continue to do that because it's that important. Having said that, you could have a vaccinated employee and a child that lives with them who is not vaccinated and isn't eligible to be vaccinated. So that's the reality of what's going on right now.
Yeah, it is creating complications, I think, for everyone.
It is.
So, well, speaking of vaccinated persons, we have new guidance this week from the CDC. Which is, I love it when they roll out new guidance. Trying to interpret everything can be quite challenging. So maybe just for a second, before we talk about what they said, let's talk about when they say something, how does that guidance make its way down to us? As soon as the CDC announces something, can we jump right on it? Or how does this work for Living Branches?
Yeah, that's right. And as you were talking there, I saw you moving your hands as you were talking. And it made me reflect that over the last couple of weeks, I've gotten some feedback about things that I do in the videos. And it's actually been kind of comical, too. There was a person from church that was teasing me the last 2 weeks about how I'll say, with that being said, and I use that phrase a lot. And it's always interesting too, because when you listen to the president's speech or whatever, and they go pan in on someone in the audience, of course, Ted Cruz sleeping or whatever those things are, people pick up on that stuff. And it's really interesting how people pick up on those nuances and those habits that we each do. And so this person was teasing me about, with that being said. So I think I'll either have to purposely not do it in this video or purposely do it every 5 seconds.
I hate to tell
just
you
to
this,
annoy him.
but you've already said it twice.
Yeah, right, exactly. And the other thing somebody else said, speaking with our hands.
Yeah.
So it's just interesting. Hopefully people are also picking up on the content, meaning get the vaccine. We're not out of this yet. But it is kind of funny to think about those things, because we all have those idiosyncrasies that we do. So thanks, Larry, for pointing that out to me about, with that being said. So with that being said, we'll get back to the topic at hand. And the answer to that question is CDC and CMS make these pronouncements, but it also comes and filters down through the state and even county for us too. So the state has what they call their HANS, I forget exactly, health advisory, or I forget
network
what HAN
or something,
stands for. But that's how they give us information of what we need to follow. So many times we will wait until the CMS or CDC pronouncements are interpreted by the state, and sometimes even by the county, because we don't want to implement something that our regulatory bodies are not going to accept. Because not only do you have the Department of Health and the HANS, you have the Department of Human Services in the state who regulates personal care, and we have to pay attention to that. Now, having said that, with that being said, that does not mean that they're going to be dramatically different, but there could be nuances that we need to pay attention to, and it's always best not to do things twice. But we have, at some points in the past, changed those directions and jumped in more quickly, because we said, this is really important. We need to do this. We're going to make certain assumptions that we know enough, because it's the right thing to do to free things up for our residents more quickly. And we've done that at certain times too, because particularly around visiting guidelines and things like that, because we felt it was so important to get residents and their families back together. So we have taken that, and I would say a calculated risk with that at certain times. But it kind of flows down through. So the interesting thing in the internet age is that all this stuff gets blasted out on the internet, and almost instantaneously someone sees it and they come and say, what are you going to do about this?
Yep.
And so people have to understand that there's a process that we need to go through and interpret to say, are we going to follow that exactly? Because we don't have to go as liberal as those guidelines might say. So it's a process that we go through. But CDC and CMS did come up with some guidelines that help interpret what vaccinated people can do that perhaps unvaccinated people should not be doing.
Yeah.
So I think it's some helpful guidelines, and we'll want to talk about some of those.
Well, and in residential living, because that is not under the auspices of a regulatory body,
Right.
It's easier for us to have a little bit more confidence that we can make the decisions to follow the CDC guidelines, and it won't be walked back as much later on.
Yeah, that's right. And certainly early on in the pandemic, we were very strict, I would say, with saying the campus is closed, because we didn't fully understand the transmission, but it was also, we didn't want people coming on campus or residential living residents spreading it into healthcare.
Yeah.
Now that the vaccine is available, now that things are changing, we can also allow more mature adult choices, if you will, in residential living, and to say, you are allowed to do X. If you're not comfortable, feel free not to follow that, but we are going to allow this to happen. Certainly one of those areas is masking outdoors. And it's been determined, and I think for some time already, that transmission outdoors is much less than indoors. And it in some ways becomes kind of obvious the way things are transmitted, that outdoors is less problematic. So they said if you're in smaller groups, and we're not going to define what that is, but in smaller groups outside with vaccinated people, you don't have to wear a mask. So that's good news. So bocce ball, croquet,
Pickleball.
Tai Chi, I know they were doing that, pickleball. If you're with a smaller group of vaccinated persons, you don't need to socially distance or wear your mask. Well, that's kind of nice, right?
Absolutely.
But that also makes it a little more difficult, right? Because what if your buddy isn't vaccinated and you need to tell him, you got to get 6 feet away from me? So frankly, hard and fast rules sometimes make it easier for people because they know exactly what they need to do. Now we're getting into this place of there's some judgment that's being allowed. And so people are going to have to get comfortable with that and figure out what they're going to be comfortable with. Yep. But whatever these changes are that we're talking about, when there's an unvaccinated person in the mix, it changes the guidelines.
Completely.
So again, that's another reason to be vaccinated.
Yeah. And it's also, I think, fair to say to residents, if you are uncomfortable in a situation, wear your mask.
Right, exactly.
It doesn't hurt you in any way.
That's exactly
it protects
right.
you.
That's exactly
So if you're
right.
uncomfortable, wear your mask.
That's right. That's right.
So that guidance regarding change for residential living will be coming out shortly for living branches. And then we're also seeing some changes in the guidance that we're going to be sharing for personal care and healthcare.
Right, and that guidance has to do with, of course, the outdoor stuff is similar to residential, but indoor, it says that persons who are vaccinated do not need to physically distance from others when they're eating. Now, they said they didn't need to mask while they're eating, which that wasn't happening anyway. I'm not sure how that works anyway. Although I did see somebody wear a mask once that was slit in the middle that they could open it. I don't know that it did any good for them, but it was kind of comical. But yeah, the piece there would be if you're vaccinated, you don't need to physically distance in activities, programs, or dining. Now, dining, they obviously already weren't wearing masks, but they were physically distanced. So this makes it much easier for dining services to set up the dining room, frankly. Yeah. The challenge becomes vast majority of our residents are vaccinated, but the guidance also says this does not apply when an unvaccinated person is in that group.
Yep.
So they didn't really define how close to the group, was 6 feet good enough, those kinds of things. So the operations teams over the next few days are working to define what that's going to look like. Because as you can imagine, there's a lot of details that need to be figured out. But it's a pretty big deal because can you imagine eating when you're physically distanced? How do you hear?
Right. This will be so important to our residents.
Exactly.
This has been the one thing that they really keep repeatedly asking for.
So be able to sit next to a person who is who's vaccinated relatively close to the table like you may be used to, you can hear so much better. Plus, in an activity, if you have vaccinated people, you can also then have persons being able to interact and again hear each other better if they don't have a mask on.
Yeah.
But again, the key here is they need to be a group of vaccinated people. So I think the lowest in any of our facilities is 87%, and I think that's healthcare.
Vaccinated.
Yeah, as far as who is vaccinated. Most places of our facilities are between 90 and 100%. So the numbers of people we're talking about here is not huge. And some may be just, on the list to get it when it's available to them at our next clinic. But there are still some residents who have declined it. And so this will, I read an article that talked about maybe it's time to start shunning those who haven't been vaccinated. Well,
this is going to do that.
That harkens back to, Amish and Mennonite days.
Yeah.
But yeah, in some ways, these new changes to the regs essentially do that. And that part is unfortunate, but the positive is it does give more opportunities for persons who have chosen to get the vaccine.
Which certainly is wonderful. And that is, as you said, the vast majority of residents.
Exactly.
It's going to be challenging, I think, for staff and for vaccinated residents and unvaccinated residents to have that divide, because we haven't had it before.
That's right. Because we have had situations too, or we do have, where maybe even the resident wants to be vaccinated, but their family is hesitant about allowing that to happen. So it's good news, but it creates some challenge too. Yeah.
And maybe we should say to folks, we have a lot of information about vaccines. Mm-hmm. If you have questions, about whether or not you want to have your loved one get vaccinated if they haven't already been, please feel free to reach out. You can email me at coronavirusquestions@livingbranches.org. You can talk with the director of your care level, any of that. We're so happy to help.
Yeah, that's right. And when I think about the efficacy, and I'm thinking of Pfizer particularly because that's the one I got, and I would say the safety of it, but the efficacy of it, of really doing something, I just feel so incredibly fortunate. I've said this on the videos before, that we have the ability. When you think of India, they have like 1 or 2% of their population vaccinated. They don't even have the availability. It's just a humanitarian nightmare.
Yeah.
And for us to be in this country and have the opportunity, I just feel so incredibly fortunate, and kind of a sense of obligation, not just to myself, but to the group, to become vaccinated, because it's a blessing. Yeah. And we're so fortunate. And so just we encourage people, and get educated. Just keep reading and keep looking at it, working at it.
Yep. Mm-hmm. Speaking of blessings, Mother's Day is coming up, which is always a day of visiting on our campuses. So maybe we should offer some guidance for people, speaking of guidance, as they consider coming to campus to visit their loved ones.
Yeah, that's right. And Mother's Day is a big holiday. I don't know, there is a Father's Day too, but for some reason it doesn't get quite the attraction. I'm not sure what's going on with that. Discrimination maybe, or something.
No
I don't
doubt.
know. But yes, Mother's Day is a wonderful day, and it's coming up shortly. And so we recognize that people are going to want to see mom, and totally get that. And because of where our visiting policies are, that can happen. But we still have the restrictions about numbers of people in a room, all those kinds of things. So we're hoping that it's going to be a wonderful day weather-wise. So really, we have beautiful campuses. All 3 campuses have lovely outdoor areas to be in and enjoy. We're not going to designate, okay, go to this area or go to that one, but just find a lovely spot outside to go outside. Personal care, it's not as much of a problem, because mostly, not 100%, but mostly, we have private rooms, and so there's not the same issues, but the numbers of people is the issue. So depending on the size of the group, depending on if someone else is in the room, really take advantage of the outside places. There's plenty of beautiful courtyards, large campuses. I know at Souderton, the pool and the community park are not far away either. We would just encourage people to take advantage of those outside spaces, because we know it's going to be a big visiting day, and we totally get that people want to do that. Of course. Because last year it didn't happen.
Yeah. Any closing thoughts for us?
I don't think so. I mean, I other than things are looking up. It looks like the positivity rates are coming back down again after they crept up a bit in Montgomery County. But I would say we still want to keep working at it, because I think one of the worst things that could happen is that after all the good work that has happened through the vaccines, et cetera, if we don't get to the magical herd immunity, whatever that number is, some of those things can be for naught.
Yeah.
So we continue to work at having clinics so new residents, new employees can be vaccinated. I hope people that aren't vaccinated will continue to get educated. Certainly over the long term, vaccines may become required. I don't know, but we'll certainly look at that. But I really do believe that vaccine, and even people that had the disease and have some immunity, all those things are together how we'll get to the other side. And so things are looking up, but let's stay disciplined. Let's keep working at it. Let's keep educating ourselves. Let's keep doing the things that we need to do. And I think we'll continue to move in positive directions.
Let's hope so. So good. Yep. Thank you.
You're welcome.
Thank you to you. We will be sending out information about the revised guidance that we mentioned. It will be on our website at livingbranches.org. So you can always check there. And then, of course, emails will be coming out as well. If you have questions, please feel free to email me, coronavirusquestions@livingbranches.org. Thanks so much.